Hi, everyone. My name is Dr. Alexandra Asrow, but you can call me Lexi if you call me anything on a video. I am an emergency physician based in Chicago. I work at a number of places, one of which is University of Illinois, Chicago, and some other critical access settings and other things like that. I'm also the founder of Emergency Medicine Global Learning Exchange, which is a nonprofit organization that I'll talk about a little bit later based around exactly that, an exchange program. So today, I'm going to be talking to you about capacity building and exchange. And at the end, the second half of this will actually be a Q&A discussion with a special guest, Dr. Asad Mian, who I will present later on. So let's get started. So overview. This is what we're going to talk about today. Capacity building, exchange programs. They're related, and I'll talk in the video, especially with our Q&A about how. But basically, what are they? How do you do this? Barriers and challenges, tips and strategies. And then we'll finish with that Q&A that I mentioned. So let's start with capacity building. What is it? Well, it's kind of what it sounds. You're building capacity, but what does that mean in the world of global emergency medicine? How do you do it? Barriers, challenges, tips, and strategies. So I will, sorry if my face is blocking this quote, I'll move myself. But basically, you can sum it up like this. Capacity building in global health has been defined as the development of sustainable skills, organizational structures, resources, and commitment to health improvement in health and other sectors to prolong and multiply health gains many times over. What does this mean? Well, remember, if something sounds obvious, that's probably the point. It's exactly what it sounds like. It may sound complex, but it doesn't need to be hard to understand. So in our setting, really, this is everything we do in global emergency medicine. Most of the projects and things that we work on, you could say, are capacity building. What does this include? Well, you have clinical skills training, development of clinics, hospitals, things like that, specialty recognition and development, just generally meeting a need that has not been met. And building, the key word here is infrastructure. So how do you do something like this? How do you do a capacity building project? Well, the tip is every project starts with a need. You have a need that you're trying to address and an idea of how to do that. There's really endless possibilities for this, and there's such a variety that there's really a place for everyone. So find your niche, whether it be for training, like direct medical training for lay people, community health workers, health practitioners, researchers, policymakers, leaders. That's one big place that people do this type of project. But it can also be improving access to care at a higher level, local population, et cetera, or more important and newer now that this has been going on for some time, sustaining already implemented programs. Basically, I'll move my face. You're trying to help a group of people help themselves to find a sustainable solution to a problem that you've identified. So I think we skipped. No, we didn't. We'll go to the next slide. So one example of this, and I think examples are a great way to learn about things, is from Australia. So there was actually a publication in my references, if you're interested, about a 20-year-long and ongoing program for Australia partnering with its own system and Aboriginal workers in a particular region, where they've put more than $2 million into this to have scholarships to promote pathways for people to get careers in healthcare that would not ordinarily have that. And what they found, not surprisingly, is this investment leads to a great improvement in capacity. I won't go into the details, but this has been a great success. And there's tons of examples like this. So you can find out more through these places. So all of the global emergency medicine fellowships have projects. And within those projects, there's lots of capacity building. So check out that first website there that has a listing of all of those projects. Also, obviously, ASAP, all of the ambassadors, they're all doing projects. So if there's a country you're interested in, or just in general, take a look at the ambassadors and see what people are working on that you might be interested in. IFEM and other international organizations are another place that you are going to find ongoing capacity building. You can also Google it. There's not really a directory of this stuff. Sorry, it's auto changing. There's not a great directory of this stuff. So try to find things and be creative. So how do we study or measure the outcomes with these projects? Well, you can look at the size or effect of the intervention. You can look at the reach or penetration into a population. Or another place that's really had more focus recently is the sustainability of the effect. I say that word a lot, but that's important for, again, you're trying to help someone help themselves. Sorry, it's going back. And so you may want to look at how sustainable that is in the future. So some barriers and challenges to this. This is hard. This is hard. It's money, people, and time are the three most common barriers to anything, but you may also encounter pushback. It's hard to get visibility, to get people to know you're even doing these things. And it's hard to quantify the outcomes. It's hard to show these effects. It's hard to sustain this stuff without money, people, and time. So it's not a clear-cut thing to do, but it is important. So my tip is don't be discouraged. Keep trying. And I will go back to my slide that keeps changing. I apologize. Every bit makes a difference, even if it's hard to measure. So keep trying. There's no secret. It's just keep working at it till you find something that works. If you go listen to a panel of experts, everyone will tell you their story, and there's always left turns and twists and things that no one expected. So keep an open mind, use your connections, use your resources. You're all in medical school, so use your institution to see what's already going on. Find a mentor, you're ahead of the curve on that, and find a need that matters to you. That's the most important, is finding something that you care about that's going to keep you motivated. So let's move on to exchange programs. And what are they? How do you do this? Barriers and tips. So I put this quote here from Senator William Fulbright, who founded the Fulbright program that I'm sure you know is a huge international exchange around the world for all types of things. And the exchange program is not a panacea, but an avenue of hope, possibly our best hope and conceivably our only hope for the survival and further progress of humanity. So how does this apply to us in emergency medicine? Again, if it sounds obvious, it probably is. That's, again, a complex topic, does not need to be hard to understand. But what I would like to boil this down to is an exchange program is a chance to learn from experience in real life, whether that's in person, whether it's virtual, whether it's just a webinar, whatever that may be. It gives you a deeper level of understanding to exchange ideas, however that happens. You can't put a lot of things into words, especially in emergency medicine. And what I tell my participants in my exchange program is once you see it, you can't unsee it. And that's the idea, is to see something that you will take with you. You'll take home souvenirs, you'll make personal connections and build that knowledge and experience via exchange. So how do you do something like this? This is hard. And this is something that I get asked about a lot since I do have an exchange program. Well, here's some places you can start. As a medical student, the IFMSA has programs around the world to do international rotations. As a resident, you can try to set up your elective. And if you're interested in that as you become a resident, keep my email, I can help. As I mentioned, all the fellowship projects or DIY, find your own path. So that's what I did. So this picture here is from one of the international talks that I did via my exchange program. They come here, but we go there too. And every program starts with an idea. You find a need, and you find an idea to address that need. And like I said, this is an endless, open-ended thing. Find your niche, find what you care about. My program, as I keep mentioning, is an example of an exchange program that I started for emergency medicine residents and young attendings from around the world to come to Chicago to spend a month here and observe and do all different types of things that residents do and really learn what emergency medicine is. We also go teaching around the world in different educational programs. And it's not just US to other countries, we're making connections between other countries and building this community on a personal level that you don't get when you go to a big conference or you're working with a big organization. It's a really different thing. And this investment has really led to the improvement in training for a lot of people that have come to my program. And I'm just one example, but I'm happy to talk to you more about it if you're interested after the talk. There's just so much need for this all over the world, regardless of the income of the country. So get involved, which you're already doing. Where can I find more examples of this? There's a few universities that do have their own exchanges in certain places. So you can look into that. Again, the fellowship projects. ASAP ambassadors and projects are a great resource. Going to conferences is a great way to meet people and make those connections. My website is there if you're interested in learning more about what I do, since we don't have too much time today. Again, there's no comprehensive directory of all this. So I lost my screen. So you have to be a bit creative. So how do we study exchange programs? Surveys, exam scores, interest in numbers within emergency medicine, patient outcomes. Again, this is a challenge to study. So you can use your own skills and creativity to figure out a way you could do an exchange and study your outcomes. Barriers are very similar to what we talked about already with capacity building projects, money, people, and time. Institutional rules is a big challenge for in-person exchange. That's why my program is observation. That was how I was able to get around the licensing and liability. There's also issues with pushback, visibility. How do you tell people you're even doing this? And the outcomes are hard to quantify. So it's not clear cut, but don't be discouraged. Even a small thing can make a huge difference, trust me. So again, no secret recipe. Creativity, you're going to hear me say that over and over in the video coming up, but that's your most important thing next to the connections that you make. Sorry, I'm going to go back here. The connections that you make via medical school, via your studies, your stuff with GEMLP, with ASEP. So use those. I cannot stress enough the importance of that. Use your institution, your mentor, and don't be discouraged. Find what matters to you. So we're going to go into our second half here with our Q&A with Dr. Asad Mian. He is the ASEP liaison to Pakistan, along with many other roles. So in the interest of time, I will just go ahead and get started. So we recorded this earlier today. Okay, so we've reached the point in the presentation now where we're going to get our Q&A and discussion with our special guest, Dr. Asad Mian. I'm going to let him introduce himself. Dr. Mian, just tell us a little bit about yourself and your background and what your interests and projects are.
Okay, how much time do I have?
Yeah, we have 10 or 15 minutes. Take as much time as you need.
Okay, so thanks, Lexi, for the invitation. So my name is Asad Mian. I am a pediatric emergency medicine doctor. I'm working in Karachi, in Pakistan. I've done a number of different things. I'm still doing a number of different things because the diversity within medicine that really keeps me going, keeps me sane as well. So Lexi, you might have to kind of like rein me in, and if I keep going on and on. But so other than obviously my clinical domain or clinical home is pediatric emergency medicine, but I'm part of a general emergency department. The Arkan University in Karachi, Pakistan is where I practice. And so as part of the ED, Peds emergency medicine is one section of it, but as the immediate past chair of the Department of Emergency Medicine, I was providing a lot of oversight to both the adult and pediatric sides of the emergency department. And then we also have various resuscitation rooms, and we have an observation unit. So I don't want to go into details of emergency medicine or what the structure of the emergency department is. But in terms of providing oversight to clinical work of different folks, and then other than clinical operations, providing oversight to the education programming of the department, which would include undergrads, so the medical students who rotate through the emergency department. And then we have a pretty dynamic emergency medicine residency program. That's a 5-year residency program in Pakistan. And so we've got residents in various years of their training. We have fellows as well. And within emergency medicine, we have research folks. We have a decent sized research team as well. So that's the reason I was mentioning that is because within the administrative capacity or the leadership role, which is really important to consider leadership roles in medicine, I was providing oversight and direction and leadership to all of those folks within the different sections or sub teams. I am a clinical researcher by training. Prior to that, I did go through grad school and was a benchwork researcher as well. I've done a bit of both, actually. I've much more clinical research than bench work, but more translational research in the emergency department, utilizing frameworks of genomics and precision medicine as well. But that project was several years back while I was still in the US. So I'm a clinical researcher. I'm an educator, obviously, that goes without saying. And
it sounds like you've had a big role here in a lot of different things that have to do with our topic today. So that's why I'm happy that you're able to join us, because you have the experience and in different roles, not just in clinical, but also in administrative and hospital settings, clinical settings, teaching, and in research. So let me lead that to our first question for you is, what is capacity building? What does it mean to you? And how does it fit into your work in different ways?
That's a great question. And so what I did not mention was that I am also an innovator, creator, and an entrepreneur. And so I would like to address that question using innovation, creativity, and entrepreneurship, because that's something I put together while I've been at AKU. I also direct an innovation and entrepreneurship startup incubation hub called Critical Creative Innovative Thinking, CCIT. So among other things that I'm talking about, I also direct this innovation hub. Capacity building for me became really exciting and interesting when I considered learners of different within different categories or different types of learners. They're medical students, or they're residents, or they're nurses, or nursing students, or they're interdisciplinary learners, interdisciplinary students. They don't have anything to do with healthcare, but they've come to the university hospital because they're interested in healthcare. And so capacity building for me becomes that unique opportunity to not focus on traditional academic frameworks of emergency medicine or medical education, but jump into or pivot towards these novel frameworks of innovation, creativity, and entrepreneurship, because these are exceedingly important 21st century skills now. Not just now, but I think for several years now. And pretty much everybody knows and understands that just having a single degree, even if you become a doctor, does not mean that you will continue in that clinical role all your life. Actually, you probably will be pivoting multiple times depending on what the situation is, what the scenarios are. So capacity building and innovation is exceedingly important from my perspective, because it helps individuals problem solve. So creative problem solving, and the starting bit being empathizing with your potential clients, and clients could be patients, could be faculty, could be students. And so I look at clients as a very big entity, right? And then so teaching or capacity building, if I may, for students, so that they have this ability to think about approaching problems in a very different fashion from what traditional curriculum-centric medical education would be. And that would just be like go through different rotations, and you do your core courses, and you rotate, and you do your preclinical and the clinical sciences, and so on and so forth. But what about this ability to be creative and innovative and be problem solvers? That's why I've studied and I've implemented capacity building in innovation, creativity, and entrepreneurship, or ICE. I'll just use the abbreviation ICE.
Yes.
So does that address your, yeah.
Those three words, so creativity, innovation, entrepreneurship. I want to point out especially the first one, creativity. So I think what, to me, and preparing this talk, it seems like the whole point of capacity building is to deal with a problem that doesn't have a solution, right? And so especially in the world of global emergency medicine and teaching and developing this specialty in varying resource settings, I think the first word, creativity, to me is the most important, because there's a reason that no one has addressed the problems that we're trying to fix with capacity building. And so we have to be creative to find new solutions. So I want to ask you, what are you have lots of experience in all these different things, but particularly in your entrepreneurship and in your, your work in the role that you mentioned, what are some of the approaches that you take to starting a capacity building project? Because it seems like this is a great idea, but it's so sort of nebulous. How do you start?
Yeah. So, great question. And so, because it's nebulous, that's why I was pretty confused, and I wasn't exactly sure, how does one approach something like this when you're not trained as an innovator and entrepreneur, or a creator even, or a creativist, as I would like to call myself. But I think the beauty of this is, like, see, that when you don't know, which means that you have the humility to say, okay, fine, I'll start somewhere, right? And got to implement. You can't wait for somebody to give you money, because that ain't coming. And you can't wait for all the right experts, because they won't come to you, because you don't have the money to pay consultants. And so, you just you just implement, right? So, so creativity as a standalone is something that's really cool. It's really exciting. A lot of people tend to lump it with innovation or lump it with entrepreneurship, but I've studied this as very systematically as a standalone. And so there are creativity frameworks, creativity profiling, and so on and so forth. If anybody wants to learn more about it, they can reach out, and I'm happy to kind of guide you in that process. But why is it important? Because you mentioned creativity, right? You've got to be creative. But then it's one thing to say you've got to be creative. You don't really know what does that mean? How are you really being creative, right? So problem solving or design thinking, through design thinking, for example, human-centered design thinking is a fascinating process. It's really simple, straightforward, but you've got to keep at it. You've got to keep implementing it in various different ways and learning from your mistakes, so that making a mistake is not the problem. Actually, it's a problem when you don't learn from it and you don't pivot, right? So prototyping, testing, iterating, these are all parts of the design thinking process, and it's a very creative process. Okay. So you don't have to be an illustrator, an artist, or a writer, or a singer, or anything like that, because that's what most people tend to believe, that that's what creativity is. I'm not denying that kind of creativity, but we're talking about day-to-day creativity, right? So how can you have something novel, and it's useful, right? So novelty that is measurable. That's how I'm defining creativity. It's not. I'm not coming up with that definition. Actually, that exists in the literature of creativity and creative thinking. Okay, so yeah, so I hope.
So what are some resources that people could look at to learn more about the human-centered design process and things like that? Because I think, as a researcher, that's something you encounter, but most doctors have no experience in either research, bench research like that, or business. So the entrepreneurship and the design part sometimes seems a little bit daunting. So what are some resources you could point for our students today that might be a good place to just learn more about it?
Yeah, so there are a lot of resources actually, right? So it depends on how much interest you have and how much time you want to commit to it as well, right? Because I did not have the time at that time, at that stage. I'm talking about a few years back, that I was going to go into grad school and get another master's or a PhD in design thinking, because there are programs out there, especially here in the US. And so
what we need is more education, definitely.
more education, right? So yeah, so just so there are I I gave you a copy of my book, right? So I'm one of 14 co-authors, right? So we do cover some aspects of design thinking for medical education, and it's chapter 9 of that book. So that book is out there. It's available on Amazon. So I'm just going to make a plug for that book.
Yeah,
But
please.
and the references. So it's all reference material. It's so you could get your hands on that book, and there are other references, and you can just Google it. Google it. There are plenty of articles on design thinking. Some are really simple, straightforward. All you've got to do is just kind of get your mind to think about, okay, how are you going to start that process, which is empathy. Okay, so I'm talking about the 5-step design thinking process that Stanford.
You had mentioned that Stanford thing when we were at the
exactly.
Yeah.
And that's mentioned in that chapter as well that I'm mentioning in the book. But if you want to look up, like if somebody wants to look up Stanford's Design School, design thinking process, or just look up design thinking articles, Google it, or you could even use Ask ChatGPT. So ChatGPT is another really good resource, by the way. So you'll get good resources, you'll get good articles and all of that. And ChatGPT is probably going to help you understand a lot of things about design thinking. So what else? Yes, and so
go ahead. Yeah.
No, I was just wondering what other resources, right? So ultimately, it's about implementing, right? So once you know that the steps are not all that, it's not all that rocket science. Actually, got to pick some problems that you're really interested in solving, and you use the design thinking process. You've got to implement.
So that's kind of takes into what I was talking about in my presentation about find something that matters to you, think about what you want to fix about it, and try to be creative and find a new solution. And I think the beauty of the fact that it is so nebulous as a topic is there's so much room for creativity and doing something that no one has done before. In a lot of these cases, there's just so much to do that it's not hard to find a topic to be creative, even if it's not something that's necessarily aligns with something that's already been done or a process that's already been done. Like you said, it's sort of good in a way to not have that background, to just sort of approach it and say, all right, what do I see here? And where can I see that I can make a difference? And, we'll talk about that a little bit more on my end, because I have a little bit more experience with that just with exchange programs, but in capacity building, which is part of exchange, and that's part that fits within that, umbrella. I think that it's really important to remember that. And also, obviously this is not an easy or a quick process, or obviously more people would do this. So can you talk about some of the challenges and the barriers and things that can be discouraging, and maybe some advice or tips on how to approach those things?
Yeah, there are a lot of challenges, right? So you mentioned one of them, right? Which it is kind of nebulous, right? And most people are not trained, and medical students aren't being taught innovation frameworks, even if it's not design centric. People just don't know what does it mean to be innovative, and what is innovation, how you're defining innovation, how you're defining creativity, how you're defining entrepreneurship, right? So I think just awareness, perhaps, like just generate these kinds of conversations, right? So it's kind of normalizing that process as well, and letting people know that it's no matter how nebulous it is, it's if you're passionate about solving a problem, it's much more important to have something really interesting that you want to address or solve. It's not the solution. So that's the other thing. The challenge ends up being that people are so wedded to their solutions. They already know what the solution is, but they don't understand what the problem is, that the solution. So the problem solution fit isn't really good because you have not understood the problem. And design thinking as just one approach. There are other approaches, right? So I don't want it,
Yeah,
to go away from here thinking that people shouldn't be thinking that this is the only way of approaching
sure.
creative problem solving. There are other ways, right? But this is because I've studied it, I've implemented it, I've tried and tested it, so hence I'm talking more about it. But
Sure.
it's um unless you kind of like start off with a very clearly defined problem, that it can take time even to define the problem. I
Learn
think
about
your
the
solution
problem
is
and really
yeah,
understand it, like you said.
really
So
understanding, right?
I'm going to ask
Um,
one more question, and then I want to
yeah.
segue from that point about really understanding it into talking a little bit about exchange programs. So can you just give us an example of, let's say, one of your favorite projects that you've done that was capacity building related?
Yeah, sure. And it might not be relevant to design thinking though, if that's
That's okay.
okay. Right? Yeah.
I'm just trying to have some little more real world, like, all right, so
Yeah.
this sounds great. What does this actually look like?
Yeah, sure. So I can use the example of medical students, right? So for medical
Great.
students, as part of their 5-year MBBS program, there's no formalized curriculum around innovation, creativity, and entrepreneurship. And so, and medical students are they're overloaded with content already.
Right.
So what we wanted to do was use an alternative approach, right? So we said, okay, fine. We do have the course content through other avenues, but rather than making it mandatory for med students, we'll create a new course and it'll be optional for them.
Okay.
And so we created this course with the medical school curriculum committee. It's called Off the Beaten Track, OTBT for short. And so we offered. In its various iterations. It's been going on for like, I think, 3 years now. And so CCIT, my innovation team, we were the first ones to start two different streams within that, just to pilot it.
Mhm.
And one was on creative innovation, and that was design centric. And the other one was startup entrepreneurship for medical students.
Mhm.
And so people from that 5-year MBBS cohort, any of those, we opened it first to first year students, actually the first year. And then over subsequent years, we started opening it to second year students, third year students, fourth and final year students. So we have a mixed bag. And so that's a great example, I think, of how this could actually be implemented, right? So rather than forcing more content, which is curricular, this could be an extracurricular or a co-curricular transcript. And so the students just have to pass. It's just a pass-fail thing, okay? And we haven't failed anyone. We just
Right.
pass everybody.
Right.
But as tied into that, the whole course can take up to 3 months because it's not. It's perhaps one engagement over a week.
Okay.
Right. So it could be over the weekend, it could be weekday. First time we started this was during COVID, so it was entirely virtual, and then we started having hybrid versions of it, and then entirely face to face. And so at the end of it, each student has to present some kind of a capstone report.
Mhm.
It could be a problem that they've looked through the design thinking process. or it could be a startup that they've been thinking about, or they already have a startup, and so they can develop that concept further.
It sounds a
So
lot
yeah,
like GEMS-LP.
yeah,
About
Gems
the
of
extra thing that like that's what we're speaking for today. And so they do their own projects as well, and design
yeah,
and things like presentations. So this is very much along those lines.
yeah,
So for time, since we just have a few more minutes, let's shift over to talking a little bit about exchange programs. So I'll talk for a minute about this, just since this is really what I do.
right.
And you can sort of contribute, because I know you've done a lot of this as well. You've done your parts of your studies in all different parts of the world, and you work in different places. And then right now you're in Atlanta, and last week you were in Philadelphia, and next week you'll be back in Pakistan. So you have experience here too. So in terms of exchange programs, I think that it's something that could definitely fit under the umbrella of a capacity building project. And I also think that, you know, especially with what we do and medicine in general, especially emergency medicine, I think that exchange programs are really a fundamental part of capacity building. Anything that is really a capacity building project, if you think about it, is also an exchange program, because it's an exchange of ideas or teaching, but most of the time has to do with someone, you know, being involved in either a department or a hospital or a location or a country that's not their usual home. And so whether it's physically traveling somewhere to teach, you know, a group of healthcare workers a skill, or to help develop a new hospital or department or something like that, it's generally someone from here going over here to talk to people here to do a project together. So for my part of exchange programs, I work with residents and young attendings to try to build the idea, the identity, and just the understanding of emergency medicine from other countries around the world to come to the US and learn from us, from watching us, from our experience. And that exchange of ideas, both for them to learn from us, but also it's really interesting to meet people from around the world like you, also to hear about what they're doing and how things are working in their hospital and emergency medicine. I think that's a really important thing, both because you learn something from each other, but more importantly, in my opinion, the relationships. When you physically go somewhere and you show that you care enough to do that, that makes an impact. And when you work with people side by side and you really get to hear about such detailed parts of their lives, you make these connections that really can turn into great things. And I mean, that's part of why we're here today talking with you. We met, 2 weeks ago at the ASAP conference, and we've done all these things already together. And so I'll thank you again at the end, but thank you for being part of this talk. But you know, can you talk about that a little bit in terms of your experience with exchange programs and what that's meant to you?
Yeah, that's actually the way you describe it, because you know I was thinking about it, and I'm like, I don't initially when you shared those questions with me, and I was like, I don't think I have participated in any exchange program, or I couldn't recall any exchange students. But now that you described it to me, yes, actually it does make a lot of sense. This is kind of like an exchange program. And
Your podcast as well, that's also kind of an exchange program in a way.
And that's so if I could use that webinar podcast series as an example of an exchange program, right? So it's in its third year. And so Medjack, the book, along with its webinar series, became that avenue to exchange ideas, really, right? So it is kind of like an exchange program through that lens. We were looking at it as our way of disseminating the knowledge, if I may. And content of the book. Each chapter of the book becomes a starting point for the conversation. Does not mean we are only going to stick to the chapter. Of course not. It's just to start that, just kind of seeds the conversation. And then it's a very interesting way of knowledge sharing and disseminating and exchange of ideas and thoughts and processes. And maybe it leads, and actually in a lot of cases, we've followed up with partnerships as well. So I think it's important to consider non-traditional avenues of exchange programs, because in my head the first thing was, when a person goes somewhere,
right,
and so that's the exchange that happens, right? Somebody from there comes here, and vice
but
versa.
I can tell you that that's the main thing that I do. But what always comes as a branch from that is the most interesting parts, is people you don't expect to meet and ways you can work together. So I think I want to stress one more time how important relationships are alongside that creativity that you were talking about, both for capacity building and exchange, both in-person programs and more esoteric things like a webinar or a virtual conference or GEMS LP, which is kind of an exchange of ideas as well, and getting to interact with people who work with, different parts of the world. So I think that's a good place to stop since we're getting close to time and I don't want to go overboard. But thank you again so much for sharing your knowledge and your experience with everyone today. And I'm sure the students will greatly benefit. And please, they'll have your information and they can check out your book and your publications and get in touch with either of us with any more questions. So
Yeah,
sorry,
sure.
time to get into more detail. Obviously, it's a long, big topic that you could talk about for a long time, but hopefully we've given a little bit of insight into what that looks like in the real world. So thank you very much. And that's all for this part of the presentation.
All right, pleasure. Bye. Have a great day.
Okay, well, if you're not sick of me yet, we're just about to be done. So just a quick recap. We talked about capacity building, what it is, how to do it, challenges, things that you can try, exchange programs in a similar way. As I'm sure you've seen, there's lots of similarities and parallels, lots of room for creativity. It's a challenge. It's a place to make your mark. And I will point out one thing that Dr. Mian said is he said, when you start a project like this, you have to say, I'll start somewhere. And I will second that. When I was thinking about starting my own exchange, someone said to me once, I was saying, well, I'm not ready. I don't have this. I don't have that. I don't know. He said to me, if you wait till you're ready, you'll never be ready. So don't wait till you're ready. Just do it. See how it goes. The worst thing is you learn a lesson and you do better the next time. So that's my references there. If you are interested, you can pause it. We'll go back to that for just a second. And some of those things I mentioned are in there. And that's it for today. So thank you so much for having me. I'm really honored that you chose me to present this topic. I hope you learned something. Please feel free to send me an email. Oh, that's the end of it. But I'll put this back. Please feel free to send me an email. And if you want to get in touch with Dr. Mian, you can look him up on the internet or I can put you in touch as well. Thanks a lot and have a great day.